What is the tissue repository? In 1984, when I decided that I'm going to study patients with pre-leukemia myelodysplastic syndromes, follow them as they develop acute myeloid leukemia, I started saving blood and bone marrow cells on my patients. Since then, maybe there's a handful of patients who refuse to give me their samples. Otherwise, practically 99% patients say yes to having their bone marrows banked in our tissue repository. And what we do is we try to also obtain normal controls. We have two germline controls we get, that is buccal smears as well as T cells from the peripheral blood. These two serve as normal controls, and then we take bone marrow aspirates, bone marrow biopsies, bone marrow plasma, serum, plasma, blood, at least 7 different types of samples from every patient. And these are banked in right now at Columbia University. I started the tissue repository in 1984 at Roswell Park Cancer Institute in Buffalo, New York. We moved to Cincinnati, then to Chicago, then University of Massachusetts, and then to New York for the last 12 years or so. And that's where the tissue repository has been. It's a very unique and precious collection of samples because every single patient has been my patient. There's not a cell that has been contributed to this tissue repository by another oncologist. And at the moment, we have over 60,000 samples from thousands of patients. Some of them have contributed more than a dozen marrows over the years. So we do study patients longitudinally and sequentially, follow their disease as it worsens into a different kind of high-risk myelodysplastic syndrome or evolves towards acute leukemia. And it's backed by a very well annotated computerized data bank which has information about the morphology, the pathology, the clinical presentation and course of the disease, as well as the treatment that the patients received and their response to therapy. So all of this is captured in a computerized data bank which backs the human samples. So this tissue repository represents a very precious collection of samples which give us a perspective into the disease in so many thousands of patients as they have progressed in the natural history of their illnesses.